The reform movement is taking place right now, especially by large organizations and innovative organizations across the country. And I think this will continue to accelerate it. I think it's a positive move. From our perspective and our organization, it just confirms what we have been doing for the past number of years anyways. And so I think overall it's positive. But I think a lot of these reform movements would have occurred anyway and would have continued irrespective of whatever would have happened today.
And that Michael Dowling, the president and CEO of the North Shore-LIJ health system, sounding off like everybody does. Everybody's got an opinion on what the Supreme Court decided today. And while the public's still trying to parse through both the decision and what it means from hospitals and doctors around the country, are also doing the same, wondering what the decision really means for them. And joining us now to break this down, what the decision means both for the healthcare systems around the country, Amit Nigam, professor of management at NYU's Wagner School of Public Service, where he specializes in the health sector. Amit, thank you very much for a few minutes, and I'll bring my table into this as well with Jim, Mark, and Andrew. You know, I had a conversation, I'll let them go unnamed, with a couple of hospital presidents who I think politically you could certainly describe as middle of the road. And while they say they like the idea or the premise of universal service, and I know universal coverage, I know that's not what we're talking about, they said that the uncertainty that was attached to this, the reimbursement issues, all those problems, they said makes it really difficult if you're a health administrator, at least for the first couple of years of this program. Do we have any reason to think that some of those headaches go away between now and 2014 when it's fully implemented, or is what we've seen for the first couple of years what we're going to get?
I think there's some room for some uncertainty for a little while, and partially it's because the legal mandate. So we know the law is going to go into force, but not all of the regulations are going to have been written yet, and the uncertainty will lessen over time as things become clear. So, for instance, in the law there is a provision for creating accountable care organizations and provisions for changing how hospitals are reimbursed. And until the regulations specifying how those are actually going to play out, what those changes are actually going to be, get drafted, then there will probably be some underlying uncertainty.
You know, let me bring you in here, Jim. We're going to bring up now a graphic here, a few graphics about what's in this, what's not, some of the misconceptions here. And when you drill it down individually, people like this stuff. I mean, nobody likes the idea that if you got a pre-existing condition, you're going to be kicked off. I think they like the fact that if your kid doesn't have health coverage, he can stay on yours till he's 26. Might not like him living at home, but, you know, they like that the kid's covered. Is this that the administration did such an awful job of selling this thing, or is it just too complicated to process for too many people, for those that are even willing to accept the premise here that government has a role in really deciding a healthcare system for the broader population?
It is a very complicated law. There are lots of parts to it and lots of bells and whistles, and I think that has made it difficult. And the Obama administration has more focused on the political side, I think, than the practical side, and that's been difficult.
It is very, I mean, people's eyes glaze over when we're just having meetings about healthcare plans at work. So this gets particularly complicated, and I really do think the Obama administration has done a terrible job at advertising after the fact.
Well, let's bring up again here, guys. Let's go through those two graphics about this plan, not even a plan, this law, okay? And again, these are the bullet points here I mentioned about the pre-existing conditions, that you wouldn't be kicked off when you get sick. Drug prices actually go down, but I defy you, if you talk to seniors, how many will attest to that. Now, small businesses, and Jim, speak to this, the amount of small business owners that say that they are getting crushed with this, when in actuality, at least from what I read, and you're close to this, there's tax credits that come attached with this. You know, between rhetoric and reality, maybe it's somewhere in the middle, because so many small business owners complain that they're being saddled with unsustainable costs.
Remember, if you're a business with less than 50 employees, you're not affected by anything. There's no new requirements. And the penalties and what you have to do if you're 50 to 200, very small. They made those penalties weak compared to the individual mandate issues. So I don't think that's going to affect things. Now remember, if people are all in the tent and buying coverage, it's going to bring the price of coverage down, because right now in New York State, small groups pay a fortune and individuals pay a fortune because only the very sick and you know, participate in these things.
All right, let me bring in one of our callers right now who is not crazy about this, and I'm going to give Ross, who's calling us from Philadelphia, a chance to sound off. And Ross, I know you were hoping this law would go down. What were your big objections with it, and I guess still are?
Okay, well, the big objections are similar. You know, they're basically going to be attacking like the poor and indigent people, where the government's saying, like, you know, the middle class is like they're doing fine. You know, I mean, everybody's being told that they got to pay this here out of their own pocket, and sometimes you don't have the money to put the money out to pay for the insurance and stuff. Next thing you know, you got to put money out hand over fist, and the government's going to be the ones controlling, or the government's appointees, the insurance companies, are going to be the ones controlling how much you have to put out of your pocket, which is going to basically be saying, like, yo, how much money do you actually have to put out into this here?
All right, Ross, let me get to a couple of those, because I know some people that support this, that argument drives them nuts. I'll let you talk to the first one here.
Here's what I would say to that. God forbid you should get sick, because if you think you're putting money hand over fist out of pocket now, God forbid anything should happen to you, you will die because you won't get treatment and you won't be able to pay.
Well, you know what, Amit, I hear from some to say, hey, we got emergency rooms for that. If somebody's sick and they don't have coverage, they can walk into any ER and they're going to take them. Now they got to reach into their pocket for it.
Doesn't treat cancer, and that's years and years and years of treatment that will bankrupt you. And I know this from personal familial experience. So you can complain about the initial outlay, but God forbid something should ever happen to you.
Amit?
And I'll add in, the emergency room care is the most expensive care you can possibly get. And all of us as taxpayers are either directly, or as people who are paying into private insurance, are directly or indirectly subsidizing it. So it means more people will pay more money for worse care.
And Jim, I'll get to the second half of his argument, which is choice. Choice is so limited under this. People want to be able to pick their own doctor. And if you listen to our last call and a lot of other opponents, they say that choice taken away from them under the system.
I think it's a choice of spending money or not, too. But remember, it's interesting. I think this law makes it difficult for the middle class more than the poor, or even lower income. If you're a family of four and earn $40,000, at least in New York State, you're probably not going to pay a dime. You're going to get this totally free. You know, if you're earning $70,000, you'll probably have to pay $300 or $400 a month for it. So, and that's where it gets to be a tough choice. If you earn $70,000, can you afford $400 a month if you haven't been buying it now? But remember that $400 a month you pay, if you had tried to buy a policy, if you try to buy a policy today, you will pay $2,000 a month for a family of four, something like that. It's a great deal, but it does take a little bit of choice away. But it's more those people in the $70,000 to $100,000 range than the people, you know, say under $50,000 or $40,000.
All right, Jim, thank you very much. Amit, thank you as well here.